Hi, and welcome to the How to Survive Healthcare podcast. I'm your host, Kayla Thompson-Riviere, seasoned critical care RN turned independent patient advocate. Tune in every week so that you can learn the things about the U.S. healthcare system that no one ever tells you. That way that you can get the most from it and optimize your health outcomes. Now, of course, this podcast is strictly to inform and entertain and should never be taken as a substitute for medical advice. Let's dive right in. Hey, welcome back to the podcast. Thanks for being with me here today. Today, I wanted to take some time to talk about how to choose your advocate wisely. Now, I know I've covered a previous episode and a little bit here and there throughout the podcast some of the reasons that you should consider hiring an independent patient advocate. And just to review, the independent advocate works for you. So unlike the staff that works at the hospital or your insurance company or your doctor's office, they have limitations to their role. The independent advocate works for you so they can stand up and fight against those entities to get you the health care that you need and are entitled to, and also to help create some cohesiveness in our very fractured healthcare system for you. Helps to alleviate some of the stress and burden of caring for yourself or a loved one when that person is also sick and in a time of need. However, unfortunately, it's not as simple as just click, click, clack finding an advocate. I have mentioned the website before, gnanow.org, or you can simply Google GNA, Greater National Advocates. It's a huge database of advocates around the country. But I would caution you when you are looking for an advocate and you're finding somebody either in a specialty for a condition that you have or just in your geographical location, please make sure that you are scrupulous when you are searching. So I want to tell you about a little incident that I was involved in. I am on a few of these databases, and I had a woman reach out to me who has autoimmune conditions and was having some other issues now that has affected her fertility. And she was looking for help to try to navigate this. The care plan that her current physician had put forward, she didn't feel was aggressive enough, especially considering her fertility is being affected. I told her that it's not something I have a lot of experience with, and I would rather find her an advocate who is more specialized and more knowledgeable in that area. I told her that I would be willing to work with her and help her if she couldn't find somebody like that, if she felt like some help was better than no help, but that I wanted to try to find someone more specialized. While trying to find someone, I reached out through, I have quite a few networks of advocates that I'm in touch with. And so I was posting around and asking if someone knew somebody who would be a better fit for this patient. And somebody commented on one of my posts, was questioning why I would want to try to find somebody who was specialized and that perhaps I was losing out on a learning opportunity. And I got so mad for a couple of reasons. Number one, I feel very strongly that people who are turning to independent patient advocates, first of all, I've been very upfront with this, that's an out-of-pocket self-pay service. So there's a lot of money involved. Number two, people who are turning to the help of an independent patient advocate most of the time have already been significantly let down by the healthcare system. They are looking to us for help, to be their knight in shining armor, to help fix their health problem that the standard route and typical that the healthcare system has dropped. they've gotten stuck in the cracks somewhere and aren't getting the care that they need. They're coming to us desperate for help. We owe it to them. We as a profession of advocates owe it to them to not take advantage of that situation. Sure, I absolutely could. I need clients right now, frankly. I absolutely could have taken that woman and taken her money and used up her time. And I probably eventually could have gotten her to the right place. And I would have learned something along the way, 100%. But that is not the way that we should be operating. I paid money and spent time learning in nursing school, and I have learned all kinds of things through my career. And now in this position where I am seeking to counsel and advise people who have been let down by the healthcare system, this is not the time for me to be learning unless I have been very upfront and forward about that. Like I said, I told that lady that if she felt some help was better than no help and she couldn't find somebody to specialize, I would be willing to take that on to help her. I've done that before with another client who had, honestly, a very complex, specific, rare thing that happened to her. And I worked with her for a short while, and we were lucky enough to find somebody who, interestingly, had a very similar condition. And guess what? When she got plugged in with that other advocate, she got linked up with the exact right doctor she needed within a couple weeks. It was like magic. And that's exactly what you get when you work with an advocate who has the experience. I believe very strongly that people, especially in this industry, should stay within their zone of genius. If it's not something that advocate has worked with before, they're probably not the advocate for you. And if they're not willing to disclose that kind of information to you, they're probably not the advocate. I'm sure you've heard it before. Jack of all trades, master of none. I don't know about you, but I don't really want to be seeing the person who's jack of all trades for a very specific problem, especially one that's incredibly time sensitive, like fertility. The other reason I took big issue with this is that the person who made that comment that perhaps I was turning down a learning opportunity and should be taking clients like this is somebody who's well respected and considered a pillar of the advocate community. I wouldn't be surprised if this ends up getting back to her and I get in a little hot water for it, but I'm okay with that. This is a hill that I am willing to die on, because again, it's important that we are not misrepresenting ourselves to potential clients just to make a buck and for a learning opportunity. So when you are looking for an advocate, there's a few things I'd like you to consider. Number one, their background. So independent patient advocacy it's not an entirely new profession. It has been around for, well, way longer than I would have guessed because I hadn't heard of it. But it's not nearly as regulated as other things in the healthcare system, like nurses and doctors and those sort of things. There is some licensing for it. So you can become a board certified patient advocate. It's not required to be board certified in order to call yourself a patient advocate. There's also no educational requirement to call yourself a patient advocate or to register on these databases. Some of them do have some requirements, but if you're finding somebody who's identifying as an independent patient advocate, just know that there is no oversight and no requirements for that person. So that just means that there's nobody looking down and saying, yes, you are allowed to identify as that and advertise as that. That doesn't mean that people without certification and without titles and letters behind their name can't do a good job. I'm not saying that. I just think that you as the consumer should be aware of that kind of lack in the system currently. So on that note, people come to advocacy usually from one of two backgrounds. Either they're a clinician, like myself, who's frustrated with the healthcare system and looking to pivot and make a difference, or they started off as a consumer, either a patient themselves or helped loved ones through situations and decided based on that experience that they could do this for other people in a more professional capacity. So obviously those come with some varying degrees of expertise behind them. So it's just important that when you are interviewing and looking for an advocate, you ask questions about their background, look them up, find them. If they have a website, find them on there. Find them on more than just one database. See if you can find them on LinkedIn and see their professional profile, or perhaps their Facebook page for their business. I really hope this comes through okay. My house has a tin roof, and I think it's monsooning now. So I hope that doesn't interrupt this podcast too bad. Quite distracting. Anyways, so make sure that you are doing your due diligence on investigating their background. Also consider what kind of assistance you're looking for. If it's just general navigation through the healthcare system, perhaps you're not looking for a specialty, and you may be better served by just trying to find someone who's local to your area so that they can go with you in person should the situation require it. However, if you have a really complicated thing going on, or particularly if you have doctors who haven't been able to diagnose you, or you feel like your diagnosis doesn't fit, or perhaps you do have a diagnosis and it's a little bit more of a rare disease, and you've had providers kind of be like, oh, I don't know what to do with you. That's the time where you should really consider finding somebody disease specific. So somebody who has experience, like I was saying to this woman, who has experience dealing with what you've dealt with, because the advantage of working with somebody is they can shorten that time between getting you where you need to be and ultimately on the track to either treatment or cure for your condition. You'll be able to shorten that time with somebody who already knows the lay of the land, who already knows the doctors who are actually good at this kind of thing. Additionally, a lot of times there's just so many other things they can recommend with it. When they've worked with clients with a specific, especially rare condition, they can probably recommend things or weigh in on options that maybe you've considered. Just having that experience, it helps so much. It's gonna give you the most bang for your buck. Now, the caveat to that being, like I had mentioned to that woman, if your condition is incredibly rare, you may be better served finding somebody either local to you or who has maybe just worked with complex things in the past. You may want to consider a clinician if you have something rare and you can't find somebody specifically in that disease area. Anyways, there's no one size fits all for every condition, but just to recap, know that there is a board certification. Oh, and I didn't mention the board certification. What does that entail? It is more on the side of ethics and kind of understanding a little bit about the healthcare system and insurance and finances. But just because somebody is board certified does not mean that they understand how the healthcare system functions inside and out, particularly if they haven't worked in the healthcare system and they don't have that clinical experience. So it doesn't mean that the certification doesn't mean anything. Don't misconstrue. That's not what I'm saying. But just because somebody is a board certified patient advocate, has the BCPA designation behind their name, doesn't necessarily mean that automatically they're going to meet your needs. Just want you to know that. So that's kind of the recap. That's a little bit of my rant here. Please do your due diligence. If you are currently looking for the help of an advocate, feel free to reach out to me. We can talk and see if I would be a good fit for you. And if not, I will be quite upfront with you about that, because I believe so passionately that it is our absolute duty to get you matched up with the help that you need. So if it's not me, I'll help you find the person it is. Please feel free to reach out. You can go to www.herdforlife.com, HEARDFORLIFE.com, or message me on any of my socials. So I hope this was helpful for you. As always, if there's a topic you want to see covered, please feel free to reach out in the same place. Take care.